recording.
Okay.
Get this started here. Good afternoon. My name is Max. I am an Oakland University nursing student, and today we're going to be conducting a health history report. All right. Could you please give me your name?
Michael Kapanowski.
Okay. And Michael, do you have a contact number, cell phone, or telephone number?
I do 734-431-1048.
All right, Michael. And could you please provide me your address?
265 Wimpole Drive. So that's Wimpole. That's Rochester Hills, Michigan, 48309.
Okay. And Michael, what is your birth date?
10/10/2000.
Okay. And do you recall where you were born?
Wayne, Michigan.
Okay. And how old are you today, Michael?
22.
22, very good. And what gender do you identify as?
Male.
Okay. And do you identify with a specific race or ethnic origin?
Just white, Caucasian.
Are you currently employed?
I am.
And what is your occupation?
I'm a CNA.
Okay.
Med tech.
And who's your employer?
Singh, SINGH.
All right, Mike. So we're going to go through just some general health questions. We're going to start with, kind of present. We're going to work through family history, and then we're going to go to current history. If you have any questions, feel free to ask. Okay. And what is the reason you are here today, seeking care?
Just a general health history update.
Okay. And do you currently have any present illness or signs or symptoms?
Nope.
All right, Mike. Could you please describe for me what your general health is in your own words?
I think it's pretty good. I am able to do all the activities that I need to do on a daily basis without feeling overly exerted. I could probably lose a little bit of weight that I gained over the last couple of years, but other than that, I think I'm in pretty good health.
Okay. Do you have any notable childhood illnesses?
I was jaundiced when I was born, but other than that, strep throat from, I was probably 7 to 10 years old every year.
Okay,
At least
reoccurring.
once. Yep.
Has that resolved since age 10?
Yeah, it has. We discussed a tonsillectomy, but then right after we discussed it, I never really got it again, so.
Okay.
no need.
You said jaundice at birth. Have you been routinely screened for bilirubin, liver enzymes, things like that?
Yeah, every time I go for a physical, I go
Okay.
over to lab test. Usually bilirubin's updated or up, higher, but nothing.
Oh, within normal limits?
Yeah.
Okay, good. Any significant accidents or injuries? Physical accidents, broken bones, anything like that?
I had a car accident my senior year of high school, so I must have been 17.
Okay.
Wasn't injured during it at all.
No injury? Were you hospitalized at all for that accident?
No.
Were you evaluated at all for injury?
No.
Any serious or chronic illnesses as a child?
No.
No hospitalizations?
No.
So then no operations?
No.
Right. Are you current with all your childhood vaccinations?
I am, yes.
All right. Any other recent vaccinations?
Yes, so I had my flu shot and my COVID bivalent booster. That would be November of 2022. And then I had my Tdap booster in December of 22.
All right. Very good. And do you do any routine health screenings?
Just kind of my, annual physical appointment.
Okay, when was your last physical?
December of 22.
And do you have any current allergies, allergens, medications, anything you're allergic to?
Nope.
Are you currently taking any medications, either prescribed or over the counter?
Just occasional ibuprofen for headaches, but other than that, nothing.
What would you say the frequency of you're taking those medications is?
Very sporadic, maybe a couple times a month.
About how many do you feel like you need to take?
Just like 1 or 2 pills, so 200 to 400 milligram.
And it generally resolves any issues that you've had?
Oh yeah.
Okay. All right, so now we're gonna move on to your family history. I'm gonna ask you a few questions regarding familial health. If you don't know, it's okay to say you don't know, but you know, whatever information you have. Family history of heart disease. Anybody in your family?
My maternal grandfather.
Okay. What about high blood pressure?
Yes, so my paternal grandfather, and then my dad is pre-hypertension.
History of stroke?
Yes, my uncle on my mother's side, so maternal.
Maternal uncle. All right. Diabetes?
Yes, my maternal aunt, my paternal grandfather, and one of my paternal cousins.
All right. Any related kidney issues
No.
to diabetes? No? All right. History of blood disorders?
Nope.
I'm sorry, to go back, was it type 1 or type 2 diabetes?
My cousin is the type 1, and then the others are, my aunt is also type 1 actually. She had childhood onset, but it's not controlled. And then my grandfather's type 2 is controlled.
And your grandfather said type 2 but controlled?
Yeah.
All right. And you said no to blood disorders?
Nope.
All right. What about breast cancer or ovarian cancer?
No.
Any other familial cancers?
Yes, my grandmother maternal had an adenocarcinoma, so cancer of the lung, and then it also cancer of the brain.
Okay.
But that's it.
Any history of sickle cell in your family?
Nope.
Any history of arthritis?
Yes, my paternal grandfather, and my paternal grandmother, so I guess both of them.
Okay. Any history of allergies?
Nope.
Good. Any history of asthma?
No.
How about history of obesity?
Yes, both of my paternal grandparents, my father, and all of my paternal uncles.
Okay. What about a history of alcoholism?
No.
How about drug addiction?
No.
Has anybody in your family been diagnosed with a medical illness?
Yes, my maternal aunt is paranoid schizophrenic.
All right. And any history of suicides or suicide attempts in your family?
No.
Any history of seizure disorder?
No.
Any kidney diseases that you're aware of? Tuberculosis?
No.
All right, good. Okay, so we're gonna go through some of your personal health history now, both present and, you know, going back into the recent past. We're gonna kind of go system by system. I'm just gonna ask you questions. You know, I want you to feel free to answer whatever you think you're feeling, but general overall state of health. What is your present weight?
Probably like 165.
Okay. And has that been, have you been maintaining that weight for the past year or so, or have you noticed any recent weight gain or weight loss?
It's probably gone up by like 10 or so pounds in the last year or two.
Okay. Anything that specific that you'd attribute to that weight gain?
I had a job where I sat for a while, so it just wasn't enough physical activity.
Physical activity. Okay. All right. How would you say your diet is?
It's pretty good. I try and eat healthy. We don't try and eat out or eat fast food very much. Try to go with more heart healthy options.
Good. How about any fatigue, weakness?
Nope.
Malaise, lethargy, feelings of just being generally tired?
No.
Fevers, chills?
Nope.
Night sweats?
No.
Any history of skin disease? Eczema, psoriasis, hives?
Nope.
Have you noticed any recent changes to the pigmentation or color of your skin?
No.
Any changes in shapes or size of moles?
Nope.
Any excessive dryness or cracking of your skin?
No.
Excessive moisture?
Nope.
Any unexplained itchiness?
No.
Do you notice any excessive or easy bruising?
Nope.
Rashes? Any unexplained lesions or ulcers on your skin?
No.
All right. Any recent hair loss?
Nope.
Any change in the texture of your hair?
No.
All right. Any self-care behaviors for both your skin or your hair?
For hair, like shampoo, conditioner, try and keep it moisturized. And the same with skin, I do lotion and then I try and wear sunscreen whenever I'm like out in direct sunlight.
Alright, your nails, would you say that, the texture, how would you describe the texture of your nails?
Smooth,
Okay, any change in the shape or the color of them?
no.
How would you describe them? Brittle, weak?
They're strong, they're strong.
Alright, and do you get a lot of sun exposure when you're outdoors?
Not typically, and when I do, I try and wear sunscreen. I only really get a lot of sun exposure if I'm traveling.
Alright, have you ever sustained any head injuries?
No,
No. Any unusual frequency or severity of headaches?
Nope.
Good. Any dizziness or vertigo?
No.
Fainting?
Nope.
Good. Alright. Any difficult with your vision?
I have glasses, but I can see fine without them as well.
Alright, and are you nearsighted, farsighted?
I'm nearsighted.
And you said your glasses accurate or adequately correct your vision?
They do.
How often do you go to the ophthalmologist?
Usually it'll be a couple years between like appointments.
When was the last time you went?
December of 2022.
Were you screened for glaucoma and cataracts last time?
I was both negative.
Any vision issues associated with double vision? Any blind spots?
Nope.
Blurring?
No.
Any notice any redness or swelling in or around your eyes?
No.
Any unusual watering or discharge?
Nope.
Alright. Okay, on to your ears. Do you notice any frequent earaches or ear infections?
Nope.
Any discharge or drainage unusually coming from ears? Any hearing loss, ringing in your ears, or dizziness?
No.
Are you often exposed to loud noises in your daily life?
No.
Right. And do you do any particular type of ear care?
Not typically. Usually I just kind of let them do their thing. Sometimes I'll try and clean them a little bit if I feel like they're like abnormally blocked up, but
No. And how do you clean yours?
usually like peroxide or something.
Okay, on to the nose and sinuses. Any nasal discharge, runny nose, nosebleeds? What about frequent or persistent colds?
Nope.
Colds that just don't seem to go away?
No.
Good. Any nasal obstructions or difficulty breathing?
No.
Okay, and you said negative, so no allergies?
Nope.
All right, any change in your sense of smell recently?
No.
Any pain in your sinuses?
Nope.
All right, and we'll move on to your mouth. Have you noticed any frequent sore throats, bleeding gums?
Nope.
What about mouth pain or tooth pain?
No.
Any lesions or sores, ulcers in your mouth or on your tongue?
Nope.
Difficulty swallowing?
No.
Difficulty chewing?
Nope.
Difficulty speaking?
No.
All right, any hoarseness with your voice?
No.
And what is your dental care like?
I brush like 2 to 3 times a day. I try and floss regularly, but sometimes I let it slide. And I use like a mouthwash also.
And do you frequently go to the dentist?
Yeah, every 6 months.
All right, do you notice any pain or limited range of motion with your neck?
No.
Any lumps, tenderness, swelling?
Nope.
Enlarged lymph nodes?
No.
Good. Same question, do you notice any pain or lumps in your chest or breast area?
No.
Any rashes, history of breast disease? Do you notice any tenderness, swelling, or lumps in your armpits?
No.
Any unexplained rashes?
Nope.
All right, any history of lung disease?
No.
Asthma, any history of asthma, emphysema, bronchitis?
Nope.
Pneumonia, tuberculosis? Right, any difficulty breathing?
No,
Any pain in your chest upon breathing?
no,
Do you notice any excessive noise when breathing? Wheezing, whistling, anything like that?
Nope.
How much physical activity would you say it takes to make you short of breath?
it has to be like, strenuous exercise, so not very easily.
Any frequent or persistent coughs?
No,
Any history of coughing blood?
no,
All right. And are you exposed to any excessive toxins or pollution in your environment?
no,
Do you recall when the last time you had a chest X-ray was?
never,
All right. Do you notice any chest pain that you would associate with your heart?
no, I don't.
Do you notice any abnormal beating, palpitations, fluttering?
Nope.
Do you notice any bluing of your fingertips, toes, lips?
No,
Shortness of breath with any exertion beyond intense physical exercise?
no,
Great. Do you have any difficulty breathing when lying down?
no,
Do you notice any swelling of your extremities, fingers, toes, legs?
no,
Have you ever been diagnosed with heart murmur?
no,
Any history of hypertension?
Nope.
Coronary artery disease? Or anemia?
no,
Have you ever had an EEG or any other
Nope.
heart tests? All right. And do you notice any coldness, numbness, tingling of your fingers, toes, extremities, arms, legs?
no, not really,
Any unclean swelling?
no,
Have you ever noticed any discoloration in your hands or your feet? This could be loss of color, reddening, bluish color.
Nope.
Do you ever notice any distended or painful veins, specifically towards maybe your legs?
Nope.
Have you noticed any frequent or unexplained skin lesions or skin ulcers?
No,
Have you noticed any excessive bleeding when you've cut yourself, or if you have a wound, do you notice it takes a long time to clot or to stop bleeding?
nope, pretty regular,
And are you frequently on your feet or sitting at work?
on my feet, usually moving around a lot.
Do you do anything specifically to help maintain circulation or keep yourself?
I just keep moving around,
Okay. All right. How would you say your appetite is?
That's good, I feel like I get hungry around the same times every day. No, I don't feel like I'm always hungry or never hungry, so just kind of regular.
Consistent?
Yep.
Any specific food intolerances?
No, nothing.
Difficulty swallowing or chewing?
Nope.
Heartburn or indigestion?
No,
Any pain associated with eating either your throat, your mouth, your stomach?
no, nothing.
Any other abdominal pains that may be related to eating?
No,
Any history or frequency of nausea?
no,
Vomiting?
Nope.
Any history of abdominal disease? This would include ulcers, liver disease, gallbladder disease, appendicitis, colitis.
yeah, I was jaundiced when I was a baby, but since then, it's kind of been relatively normal,
Any excessive flatulence?
No.
What do you say the frequency of your bowel movements are?
Probably like once or twice a day, usually, and they're like normal. No, they're not like, it's not hard to pass them, they're, firm, but not too firm.
Did you describe their consistency, color?
Brown in color, kind of firm, but not, overly firm, soft. Yeah, I guess that's it.
Have you ever noticed any black stools or blood with stool?
No.
Any constipation or diarrhea recently?
Nope.
You take any over-the-counter medications to control constipation or diarrhea?
I do not.
Have you ever been diagnosed with hemorrhoids or a fistula?
No, I have not.
Right. What about urination? What's the frequency of urination?
Probably like between 3 and 5 times a day. Depends on how much I'm drinking and
And would you say, what's your urgency? Do you ever feel like you can't make it to the bathroom in time?
No.
Do you ever wake up at night to urinate?
I do not. Nope.
Any pain with urination?
No.
Any difficulty or need to exert, more force or pressure to
Nope.
produce urine? What color would you describe your urine as?
Like pale yellow.
And would you say your urine is clear or cloudy?
Clear.
Any history of urinary disease? This would include kidney disease, kidney stones, urinary tract infections, prostate diseases.
Nope, nothing.
Do you notice any pain in your flanks and around the back and around your groin area?
No.
Urination? Have you experienced any penis or testicular pain recently?
No.
Have you noticed any sores or lesions?
No, I have not.
Any abnormal discharge?
No.
Any lumps?
Nope.
Have you ever been diagnosed with a hernia?
I have not. Nope.
Do you perform any self-examination, testicular self-examination?
I do. Probably once a month.
Are you presently in a relationship involving sexual intercourse?
I am not.
Alright. Have you ever been diagnosed with an STD?
Nope.
Have you ever been screened for an STD?
Yeah, part of routine, but blood screens, but nothing. There was nothing that really prompted it.
Do you have any history of arthritis or gout?
No.
Any painful or stiff joints?
Occasionally my knee hurts, but I have to bowl a lot for that to happen.
Okay, so knee pain with bowling.
Yeah.
And what would you say is a lot?
Probably excess of like 8 games, 9 games.
Okay. And where about in your knee? What location?
Just right behind the kneecap.
Okay, and does the pain stay in the kneecap area or does it move?
It stays there.
Okay, and what do you do to treat the knee pain?
I have a compression sleeve that I use that kind of helps prevent it from happening, but if it does happen, I just take like an ibuprofen,
Okay.
200 milligrams, and it's gone.
Have you ever sought any medical care on your knee?
I mentioned at an annual physical, but it was just gotta exercise it more and kind of do some stretching exercises, which has helped.
So you've instituted some pre-stretching exercises?
Yeah.
All right. Do you notice any limited range of motion with any of your movements, arms, legs?
Nope.
Any swelling?
No.
Any excessive noise like grating or grinding in your joints with motion?
No.
Any unexplained muscle pains, cramps, or weaknesses?
Nope.
Any difficulty walking?
No.
Any difficulty coordinating physical activity?
No.
Do you feel clumsy or
No.
any history of back pain?
No.
What about back stiffness or difficulty with range of motion?
No.
Any diagnosed back disc disease or?
Nope.
How much walking would you say you do per day?
Usually between like 12 and 15,000 steps a day-ish. Modify a lot.
And do you feel you are physically capable of performing all your daily activities, moving, dressing, changing?
Yep.
Okay. Do you have any history of seizure?
No.
How about stroke?
Nope.
Fainting?
No.
Any blackouts?
No.
Have you noticed any unexplained weaknesses in your extremities, any tremors, any tics, any abnormal muscle movements?
No.
Any numbness or paralysis, fingers, toes, arms, legs?
No.
Have you noticed any change in your memory? Difficulty remembering things?
No.
Any change in your mental status or mood? Depression, nervousness, anxiety?
No.
Have you ever been diagnosed with any mental health illness?
No.
Have you ever sought treatment?
No.
Have you ever experienced hallucinations or delusions?
No.
All right, do you notice any excessive bruising
No.
of your skin?
Mm-mm.
Any excessive bleeding of your skin?
No.
Any swelling of the lymph nodes?
No.
Does your job or home life expose you to any toxic agents or radiation?
No.
Have you ever had a blood transfusion?
Nope.
The history of diabetes?
No.
Any history of thyroid disease?
No.
Do you notice any abnormal intolerances to heat or cold temperatures?
No.
Do you notice any excessive sweating?
No.
And do you think that your weight and appetite are appropriate?
I do, yeah. I feel like if I, eat my normal amount and I'm full, then I, can maintain or lose weight. But, if I overeat and go kind of crazy on it, I definitely gain.
All right. Okay, we're gonna get into a little bit more of a functional assessment here. So could you please tell me what your highest level of education is?
Bachelor's degree.
All right, and any other significant trainings
Yeah.
beyond that?
Yes, I'm a CNA, so I have my nurse aid certification and medication technician certification.
All right, and is your financial status adequate, your income adequate for your lifestyle and to manage any health concerns you may have?
Yes, it is.
Do you have any specific religious or faith-based value systems?
I'm Catholic.
And are there any specific practices of your religion that you engage in?
No, I usually try and watch church every week, but nothing crazy.
What would you do for self-care? Behaviors.
Spend time with friends, go bowling, sometimes I just like to relax inside and read a book or, watch some TV.
All right, could you describe for me what activity and exercise looks like for you?
So I guess activity-wise, I try and do workouts in my apartment, so I'll do sit-ups, push-ups, jumping jacks, that kind of thing. I have a little app that kind of designs workouts. Try and do that like 3 times a week, just to keep active. But I do a lot of walking, so.
All right, and do you do any specific monitoring of your heart rate or your body's response to exercise?
Not really. I wear like the watch that kind of tells me all that,
Oh, that's
but
good.
I don't really monitor it religiously.
All right. And how much sleep would you say you get every night?
Probably 6 to 8 hours.
And do you have would you say your sleep, your bedtime, and your wake time are frequent, or, I'm sorry, not frequent, are consistent?
Yeah.
About what time do you go to bed every night?
Usually 10 o'clock.
And what time do you wake up?
Usually 6.
Are you independent with all of your ADLs, feeding, bathing, hygiene, toileting, dressing?
I am,
No.
yes. Yep. No assessments.
And any leisure activities besides the ones previously mentioned that you enjoy?
Nope, that was pretty much all of them.
All right, if you could for me, I'd like you to think back over the last 24 hours and tell me what you had to eat.
Okay, so like yesterday for dinner, I had like 3 White Castle sliders, which is uncharacteristic, and a smoothie. This morning I had an egg sandwich for breakfast, and then for lunch I had like a tofu veggie stir fry thing.
And this is fairly consistent with your normal?
Yeah, usually I don't eat fast food, so that was kind of the only thing that was out
Okay.
of character for me.
And who purchases the food for you usually?
I do,
And who prepares the food for you usually?
usually myself.
And do you find that your finances are adequate to purchase food?
I do.
Right, and who is present with you at mealtimes, if anyone?
Usually my brother, we live together.
All right, I'm gonna ask you just a few questions about your family here. Describe your role in your family.
Really just like a son and a brother. That's really it.
All right. No, that's plenty. How do you get along with your family and friends,
Oh,
coworkers, classmates?
well, I have no issues getting along with people.
Good relationships?
Yeah,
Do you feel that you have a good system of support from your family and friends?
I do, yeah. I have a good family support system.
How much time do you usually spend by yourself in a day?
Maybe 2 to 4 hours. Depends on the day.
And do you find this to be pleasurable or isolating, being
Oh,
by
it-
yourself?
It's nice. I usually use it to study.
Describe for me what life stresses you currently have.
Really just kind of just school, you know. That's kind of a big stressor. Work can be stressful sometimes, you know, when things go wrong. Kind of how healthcare is, but
Do you feel that you're adequately managing the stresses in your life?
yeah. All those kind of mechanisms I mentioned earlier help a lot.
Any specific coping strategies or management strategies that you like to use?
Bowling works well. Usually if I get overly stressed, I'll just kind of take some time to go bowl and just let everything kind of roll off, you know.
Any significant changes to your stressors in the past year?
Except, well, I guess except starting nursing school, that's a change.
And do you use caffeine or drink beverages?
Yeah, I
Caffeinated
drink
beverages?
probably a cup of coffee a day, and then I drink one like the Celsius energy drink beverages. Sometimes every day, sometimes every other.
And about how many ounces are those energy drinks?
Like 8.
Do you smoke?
I do not.
Have you ever smoked?
No.
Alright, very good. Do you drink alcohol?
I do.
Describe your drinking habits.
Probably once a week socially.
When was the last time you drank?
Last weekend.
Alright, and about how much did you have to drink then?
2 to 3 beers. I don't drink a lot.
Is 2 to 3 drinks consistent with your general drinking?
Yeah.
In the last month, about how many days have you had alcohol?
Probably 5 or 6.
Has anyone ever told you you have a drinking problem?
No.
Do you feel you have a drinking problem? All right, I'm going to ask you about some drug usage here. Have you ever used marijuana?
No.
Cocaine?
Nope.
Heroin?
Nope.
Any barbiturates? Amphetamines? Crack cocaine?
No.
Prescription painkillers that you were not prescribed?
No.
LSD?
No.
Any other street drugs that I failed to mention?
No.
Have you ever received any treatment or counseling for drugs or alcohol?
Nope.
All right, and do you live in a house or an apartment?
A house.
A house, and who lives there with you?
My brother.
All right. How familiar are you with your neighbors?
Not too familiar. We just purchased the house, but I've met a couple of them.
You get along so far with your neighbors?
Yeah.
Do you feel you're safe in your neighborhood?
I do.
Do you have adequate income to pay for your heat and utilities?
I do.
Do you have access to transportation?
I do. My brother has a car, and so do I.
Are you involved in any community service?
The occasional, like, volunteering at a food pantry or with bowling, but that's it.
How do you volunteer at bowling?
Coaching.
Who do you coach?
I used to coach a lot of bumper bowlers, so little
So
kids.
kids,
Yeah, and then sometimes high school now that I'm, a little bit higher level.
are any hazards, at your home or workplace?
No,
Physical, chemical,
just bloodborne,
exposure hazards
just bloodborne,
Bloodborne.
work, but
at work?
Yeah.
Do you use seatbelts when you're in a car?
I do,
When you're driving and as a passenger?
yes, I do.
Do you travel frequently to other countries?
Mexico, probably every year,
Okay. When was the last time you were there?
January of this year.
Have you ever lived out of the country?
No,
You ever engaged in military service out of the country?
no,
Do you feel safe in your own home?
I do.
Have you ever been physically or emotionally abused by anyone who is close to you, a family member, a friend, a loved one?
Nope.
Have you ever been hit, kicked, slapped, pushed, shoved, otherwise physically abused by a partner or ex-partner?
No,
Has anyone ever forced you into having sex?
no,
Are you afraid of your current or former partner?
Nope.
Can you please describe your job for me?
so I'm a CNA, so I help, seniors with, activities of daily living. And as a med tech, I, help kind of coordinate with physicians and kind of advocate for patient needs. And then, with the licensing of the assisted living facilities, I can also help pass meds.
And so you work in an assisted living setting?
Yeah.
Is your work bringing you into contact with any health hazards?
Just bloodborne, but we have, PPE and stuff for that.
Okay.
Fine.
You have adequate equipment at work?
Yeah, I do.
And do you have at work programs designed, exposure protocols, preventative protocols, programs?
Yeah, we have emergency, response and exposure protocols, and then obviously all the OSHA and med guidelines, state guidelines.
Do you have any current health problems or former health problems that you think are related to your job?
No.
How do you define health?
Just kind of being able to do, the things that I want to do. Obviously being healthy, not being sick. And just kind of, I guess, being able to go through life without, really having to have it be difficult to do things,
Do you have any concerns with your health?
No, I could probably lose a little bit of weight, but, like 10 to 15 pounds, but, other than that, I think I'm pretty okay.
And what do you expect will happen to your health here in the future?
Expect to, lose a little bit of weight, kind of by, restricting my eating and then, exercising a bit more. Other than that, just kind of keeping the same good health profile that I've had.
Okay, and you said your goals are to exercise more and to lose some weight?
Yeah.
You said about 10 to 15 pounds?
Yep.
Alright, and what are your expectations of your nurses or physicians?
Just kind of help me achieve those goals, and if I end up needing any additional help or kind of counseling or to move forward with those goals, that they help me do that.
To provide care if
Yeah.
necessary?
Provide necessary care. Yep.
All right, Mike. That just about wraps it up. Do you have any questions for me?
No, I do not.
All right, well, thank you very much. We got everything we need, and I appreciate your time, and we are all done.
Thank you.
All right, have a good day.
You too.